Well, good morning. Thank you very much for being here today. Have here with me the best lieutenant governor in the country, Boyd Rutherford, standing next to me. We've got our great county executive from Anne Arundel County, Steve Schuh. Thank you. And also from Anne Arundel County, State's Attorney Wes Adams. We have Health Secretary Dennis Schrader. The Director of the Governor's Office of Crime Control and Prevention, Glenn Fueston. And our host here this morning, Tori Bayless, the President of Anne Arundel Medical Center. And we have a number of our legislators here with us this morning, delegates and senators. Why don't you guys just stand up and wave? Thank you for coming. I think we also maybe have a sheriff and a police chief and a few others here as well. When I ran for governor 3 years ago, we were traveling around the state. And I was a little bit surprised that I went into every small town and every county, whether it was a busy, bustling urban county or a suburban area or a small rural county. Almost everywhere I went, I asked the local elected officials and some of the folks in the community, what's the number one problem facing your community? And the answer was always the same. It was heroin. And I was a little bit shocked by that, I got to tell you. I knew heroin was a problem 3 years ago. When I first started looking at it, I had no idea how pervasive it had become. It was in our smallest county, our most rural town. It was in our suburban areas. It was in our cities. It was affecting every socioeconomic class, people everywhere. Families were being torn apart. Communities were being torn apart. It was killing people on our streets. And I got as focused on that as I could. The lieutenant governor and I started focusing on this issue. We brought in treatment providers and experts from all over the state before we got these jobs, when we were just in the beginnings of our campaign to say we want to find out more about this problem. And so we continued to focus on it and talk about it the whole year-long campaign. And we said if we were elected, we were going to make this a priority for our administration, that this was a crisis that nobody was paying attention to. Not enough people were focused on. It was happening all across the country, but it was particularly bad here in Maryland. It seemed as if it was being swept under the rug, and nobody would talk about it, because it's a really hard problem to solve. And maybe it's easier if you just don't talk about it. But we decided to shine a spotlight on it and to focus on it and to try to save lives in our communities. Now, Marylanders from one end of the state to the other, know the devastation that heroin and opioid abuse can cause. And it literally is tearing apart families and communities. I personally, many people in the room probably have some friend or loved one or family member that's been touched by this. I lost a first cousin to this terrible disease with a heroin overdose myself. It's under the surface of every community. And we decided we're going to shine a spotlight on this and try to find as many possible solutions as we could. So as soon as I was elected, the very first thing that I did was I put the smartest man I know in charge of this problem, and that was when I appointed the Lieutenant Governor, Boyd Rutherford, to head up our efforts in this area. And he focused on it like a laser beam. We signed an executive order creating the Heroin and Opioid Emergency Task Force. And they held hearings around the state. They got input from people from every aspect of this problem, and I think hundreds of people showed up at these different regional hearings and testified. We got tremendous input, and a great commission of people came up with 33 recommendations, all of which we're implementing. And we made some real progress with the state legislature last year. These are all over the map, from prevention and treatment to law enforcement and interdiction. And we have to attack it from every direction, and education is a major part of it as well. In addition to that, I got together with the governor of Virginia and the mayor of D.C., and we formed a regional compact to focus on this together, because certainly a lot of this takes place across state lines, and it's impacting and affecting all of us. Yesterday, we had a meeting with our federal delegation from Washington, all 8 of our congressmen and our 2 senators, and we told them this is one of our #1 priorities, is to get some help from the federal level on this terrible problem. They don't seem to be focused on it either. I got together with, I think, 47 of my colleagues in the National Governors Association, Republicans and Democrats from nearly every state in the country, who signed a letter asking for the federal government to focus on this problem and to provide funding to the states. This is not a problem that we are going to be able to solve by ourselves, or any other state is going to. It's going to take the federal government, the state government, the counties, the municipalities, the communities, the faith-based organizations, the volunteer groups, everybody, the families. Everybody has to focus on this because it's a crisis that is nearly doubling every single year, and it's getting more and more dangerous, and it's evolving as a crisis. The shift recently has been to fentanyl, and it's 100 times more powerful than heroin. And it's killing people left and right, sometimes the first time they ever get exposed to it. And the crisis is continuing to evolve and continuing to grow no matter what, even with all the help and all the work that we've been doing. And others have, like Anne Arundel County has been taking some great steps as well, and many of our counties across the state have. But as this crisis evolves, so must our response to it. And so today I'm going to turn the floor over to really the man who's been leading this fight for us, Lieutenant Governor Rutherford, who is going to announce today, and a few other people will speak as well, but we're going to announce last year we took a lot of steps in the legislative session. This year we will be announcing our 2017 Heroin Prevention, Treatment, and Enforcement Initiative.